Hello guys, it's Mala here from InnovaX Global Health. So what I wanted to talk to you guys today about in terms of the coronavirus is what do you do if you're infected, also known as supportive care. So one of the things I want to start off that's really important to know is do not take any medication that has not been approved for the treatment of coronavirus, because right now studies are still being done to see what the effective medication could be. So chloroquine is an example that has been going around. It has not been fully tested to prove that it's an effective medication for either the prevention or the cure of the disease. So it's really, really important. So that brings us to the next question, then what do you do if somebody is infected with the coronavirus? Well, the standard right now based on the World Health Organization is supportive care, meaning you treat the symptoms that come along with the viral infection while the immune system fights the virus, which is the normal process when something like that happens. So what supportive care means is right now we do know the most common symptoms of somebody who may be infected is having a fever. A fever, it's actually if your body temperature goes normally around 38 degrees Celsius or higher. So you want to start, and this is also an instrument or an easy tool, a thermometer, that all of us should try to keep at home. That way if your body feels hot, the first thing you could do is just use a thermometer to see if you have a fever. Now, if you do have a fever, going back to supportive care, you support the fever by taking a fever-reducing agent. So here I have our quality choice ACETAMINOPHEN, also known as TYLENOL, that is an effective fever-reducing agent. So first step, if you do check your temperature and you do confirm that you have a fever, you could take ACETAMINOPHEN on the prescribed dosing, which is really, really important to help bring that fever down. An alternative to ACETAMINOPHEN is actually IBUPROFEN. We have a QC brand here as well. So IBUPROFEN is an anti-inflammatory medication, meaning it helps with inflammation, but it's also an effective fever-reducing agent. So even if you have some body aches that comes with the fever, it could be an alternative to the Tylenol, or some people a pharmacist could tell you how to take both at the same time, just to make sure your fever is taken care of. So the next supportive care agent that we have is a cough suppressant. So if coughing is one of the symptoms that you do have, find a good cough suppressant that can kind of help support the symptoms. Remember, you want to treat the symptoms, not the virus, because your body is going to have to fight the immune system. A cough suppressant is really, really effective. If you have a sore throat, we do have some sore throat lozenges that you could find that more works by just treating the topical area. So if you have pain swallowing, just take a sore throat lozenge to treat the symptom. So one of the things that is really important to keep in mind is most people that are infected with a viral infection, even if it's a flu or it's a coronavirus, hydration is extremely important. Making sure you're drinking a lot of electrolytes. So even if that's a form of an electrolyte solution, electrolyte powder that you mix with water, or your basic drinks like vitamin water that has a lot of vitamin C, that also has some electrolytes, just to make sure you do the right things. And the same goes with supplements like vitamin C, right? That could help build your immune system. Because one thing we want to realize is the moment you are infected with coronavirus, that's when you start making sure your body is in the best state to fight the infection, right? So what you don't want to happen is, or if it does happen, where on the more serious cases when you do have difficulty breathing, that's when you need to reach out to a medical professional in the Gambia call 1025, because the more advanced supportive care will require ventilation and oxygen that could be provided at a hospital system. So please seek out good information, leverage the World Health Organization, reach out to medical professionals in your community if you do need these supportive care items, and just be safe. Thank you.